Well, again, welcome to everybody who has joined us today for this first session of the 2017 AgrAbility Virtual National Training Workshop. This is the first of 6 webinars that we'll be presenting over the next 3 days. We hope you're able to join us for as many of those as possible. My name is Paul Jones. I'm the manager of the National AgrAbility Project that's headquartered here at Purdue University in West Lafayette, Indiana. Our opening session of the virtual conference for this year is on hand health, and our presenters are Carla Wilhite and Trish Siegel from the University of New Mexico. I will give just a few basic webinar instructions before we begin the actual presentation. Audio, hopefully you have realized, is available through either your computer or a phone. You can make adjustments or test your audio settings through the Communicate menu at the top left of your screen. We also have captioning available, and you'll find that under the Media Viewer tab on the lower right of your screen. Now, you will probably have to enter some basic information about who you are and submit that before you're able to see the captions. And you may have to minimize some of the other windows on that right panel in order to see the captions fully, which may mean not being able to see the video of the presenters. But you can adjust any of those pods on the right-hand column by either clicking on or off on the arrows. You can also expand or contract that right column by dragging along the line between that and the presentation window. If you have any comments or questions for our presenters, please feel free to either, first of all, use the chat window or the chat pod on the right side, and you'll need to put in your question and also hit the send or submit button so that we make sure that we're able to see that. Also, if you have questions and would like to ask those verbally, we will have a question and answer period at the end of the presentation. So you should see a little hand icon next to your name, and you can click on that to raise your hand. If you do that during the question and answer period, we will do our best to enable your microphone or phone line and then allow you to ask your questions verbally. Right before the question and answer period, we do have 4 quick poll questions. So please stick around for those. And then we are recording this session. We'll be archiving it on our website, the agrability.org website, under online training and then the archived webinars. If you have any questions or comments or problems about technical issues, feel free to use the chat window also about those. If you cannot use the chat window for some reason, please feel free to email me, jonesp@purdue.edu, and that was the email address from which you received your webinar instructions. So you can simply reply to one of those emails. For those of you who might not be familiar with AgrAbility, our program is sponsored by the U.S. Department of Agriculture, and we focus on issues related to disability in agriculture. Every one of the AgrAbility projects is a partnership between a land-grant university and at least one nonprofit disability services organization. Currently, there are 20 state projects around the country, and there's one national AgrAbility project, again, that's led through the Purdue University Breaking New Ground Resource Center. The partners that we have on our national grant include Goodwill of the Finger Lakes, APRIL, which is the Association of Programs for Rural Independent Living, and also Colorado State University. If you'd like more information about AgrAbility or would like to review one of the more than 55 webinars we've done in the past, feel free to check out agrability.org. There are a lot of resources there and also the contact information for those state projects. At this time, I'm going to turn things over to our presenter, and we're going to be starting with Carla Wilhite today. Any of you that know much about AgrAbility know that Carla is not a stranger to our program. She's been a staff member at the Oklahoma AgrAbility Project and also at the Colorado AgrAbility Project. Currently, she's at the University of New Mexico in the occupational therapy program there. So at this point, I'm going to disconnect my microphone and camera, and I will return later during the question and answer period. But for now, here's Carla.
All right. Thank you, Paul. Appreciate that introduction. I see a lot of names on the attendee list that I know. Give a shout out to my friends in Kansas and Nebraska and Colorado. It's good to see you guys on here. And I look forward to talking about how we can maximize hand health, not only for our own hands, but for the people that we work with, the AgrAbility customer. And there are a lot of reasons why I chose talking about hand health, so let's just go ahead and get into it. So learning objectives for today is just to get you a little more familiar with basic hand anatomy, understand some of the typical functions of the hand, and also to just increase your knowledge about common hand injuries and cumulative trauma disorders that can happen in the industrial workplace, the farm workplace. And then hopefully we'll wind up with just being able to verbalize some strategies for improving hand health for folks who are at risk for injury and for those who already have arthritis or hand limitations because of an injury or disease process. So first thing is just let's define the hand. And I know some of you are connected by phone. I have a photograph of a hand through an X-ray. And we can basically just say that the hand is a paired organ, and it's our chief way for physically manipulating the environment. You know, whether it's raking a pill out of a small pill bottle or putting nuts and bolts together. It's just an amazing engineering marvel that's made up of, about 27 bones in the hand. And then you have all the attachments like ligaments, the muscles of the hand, the tendons, nerves, an incredible blood vessel supply, and then the skin and the nails. And we all know, very versatile tool, very agile. It's great at completing routine tasks and doing precision movements. So the right hand is actually controlled by the left part of your brain, and your left hand is actually controlled by the right part of your brain. So it's really heavily wired instrument of the nervous system. So just as a practical exercise, just do this for me. Just tuck your thumbs into the palms of your hands and just reach down and imagine tying your shoes. So you probably notice immediately that that is an incredible problem. So without our thumbs, we are a much less useful animal. So let's talk a little bit about anatomy. We're going to just go over a little bit of shoulder, upper arm, forearm, the wrist, the hand, and the fingers, because really the hand, if you want to think about it, really starts at the shoulder. So let's give that a look. All right. So I've got a couple of photographs. We're looking at drawings. We're looking at the shoulder from the front, or what anterior view, and we're also looking at the posterior view, or the back of the shoulder. And the shoulder is so dynamic. It can move in what we call multiple degrees of freedom. And the main components of the shoulder are the scapula, which is basically our wing bone of our shoulder, and then the clavicle. And I'm just going to see if I can use the highlighter to point those out. So here, well, it worked when we practiced. Let's see. There's a pencil. So this area that I'm highlighting in yellow, that's called the glenoid fossa. And it's just really this very shallow dish. Compare that to the humeral head. So that's the big arm bone that fits into the glenoid fossa. See how huge that thing is? And that huge bone rolls and spins and glides across that really shallow dish. And that's what gives us our incredible amount of freedom of movement of the shoulder, and also the thing that makes us very vulnerable to injury, because it doesn't have a nice deep socket like, say, a hip. It's so shallow that it's literally just held in place by the muscles and ligament structure of the shoulder. And then just pointing out the clavicle. This little guy often gets fractured in the winter when people slip and fall on the ice. And the clavicle is the only place right at the breastbone where the shoulder, the arm, attaches to the main part of the skeleton. And its basic function is a crank, and it allows us, by constraining muscles and cranking movement, to raise our arm over our head. And then the movements that come out of the shoulder, and we can again look at the illustration of the back of the shoulder, and these are called the rotator cuff muscles. So you have the supraspinatus, the infraspinatus, the teres major, and then the muscles on the front. You have the pectoral major and the teres major. And those are basically the muscles that steer the shoulder. All right. So I think we've got that down. I'm not seeing any pressing questions. So as we move down from the shoulder, we see that the long arm bone, the humerus, and we also see the elbow joint right in the middle there. And that elbow joint is basically like a door hinge. It just opens and shuts. And then the two smaller arm bones, the one on your thumb side is called the radius. The one on your pinky side is called the ulna. And they have some beautiful movement. They can basically turn and rotate, which allows us to either supinate our hand, turn the hand up towards the ceiling, or pronate our hand by turning our hand down towards the floor. So you get flexion and extension of the elbow. You get that beautiful rotational movement of the forearm. So let's take a look at the wrist. And it's made up of several carpal bones, and you can see they're basically in two rows. And these carpal bones, this row and then the back row, articulate or interface with the ulna and radius. And they're remarkable. They can do basically three things. They can flex and extend and then deviate. So they can just literally translate towards the pinky side and translate towards the thumb side. And I will show you those movements on this next slide. And the reason the wrist bones are so important is you can think about them as kind of fine-tuning where the hand is going to interface with an object or something in the environment. So in this slide, you see the photos of the wrist movements, the flexion, the extension of the wrist, the radial and ulnar deviation, and then the pronation and supination of the forearm. And all the things that help with creating these movements of the from the shoulder to the fingertip involve muscles that move the bony segments. There, you might think about them as the cranes and levers and mechanisms that create movement, and then the tendons, which are the termination of those muscles into the bone, which have very firm attachments to the bone, but can be torn in an accident or an injury. You also have cartilage, which lines the articular joint surface and reduces friction. So it's sort of like the Crisco of the joint in terms of making it easy for things to slide across one another. And then you have the ligaments that connect across the joints, and then other mechanisms of joint lubrication, like bursa, which can become inflamed and create problems, and we'll look at that in a little bit more depth soon. And then, of course, just the beautiful wiring and blood supply that we have to the entire arm and hand. So some of the main hand functions should look really familiar to you because you do them in your daily life. But our grasping patterns, and excuse the misspelling on the picture, it's not a cylindrical grasp, it's a cylindrical grasp, but I couldn't find a better picture. But we can basically do these grasping patterns. We can do hooks, like when we're carrying a suitcase. We can do spheres, like holding a ball. We can hold cylinders, like our Coors beer can at the end of the day. And then we can grasp in ways that increase our power of hand function or our precision. And so some of the precision grasps that we do involve pinches. And there are three main pinches. You have the palmar pinch, which is basically, you think about it as a drill chuck that has those three pieces coming together. So you have thumb, forefinger, middle finger, and they come together in a nice strong pinch. You have the lateral pinch, that is the thumb against the long finger, and that's the kind of pinch precision grip that we have for keys and holding objects. And then, of course, the very precise grip that we have with the hand, which is the tip pinch, the index finger against the thumb. But so let's not also forget that not only do we get power grips out of the hand and the fine motor manipulation out of the hand, but it is also our greatest sense organ. It feels pain, very fine touch, discriminative touch. It can identify objects without vision, and also can feel vibration. So it's not only allows us to do all the movement things that we need to do in terms of holding on to things and manipulating materials, but it also allows us to investigate the environment in terms of sensation. So it's just really a beautifully well-engineered object, the hand. All right, so we've reviewed the anatomy. Let's just talk a little bit about some of the stats that I found on hand injuries. This was actually surprising to me, but there are over 1 million hand injuries in the workplace every year, and that's coming out of OSHA back in 2007. And they actually said that it's probably underreported. About 20% of disabling work injuries are because of hand injuries. And again, this is the entire workforce, industrial workforce. And then 205,000 of those injuries to the wrists or hands or fingers involve days away from work. You know, and we all know from working with farmers and ranchers that the days away from work is just not a possibility many times. And it's just because of the versatility of the hand that subjects it to many kinds of injuries that put it at risk. But we have strains, we have sprains from excessive forces, excessive repetitive motions. We work in very awkward positions many times to try and fit our bodies to the workspace. We often have contact with surface conditions that are less than optimal for hand health, whether it's a hard surface, a sharp edge, something cold or too hot, and rough surface conditions where we abrade our hands against that. So many kinds of skin irritants are in the environment. There's the possibility, of course, of being burned during work, suffering from some kind of puncture injury, having some kind of cut, fracturing, and even bites, both from animals and insects, and also just out-and-out amputations of some of our hand or arm. Okay. So when we're thinking about what other things contribute to hand injuries in farm work, some of the literature says that it comes down to the farmer's state of mind. So the amount of attention that they're giving to the work, and we all know that fatigue can decrease our attention, so we might be inattentive to some type of hazard in the workplace, but also attitude towards safety, which has been a very large topic in farm safety and health for a long time. But other contributing factors, not just the behavior of the farmer, but just musculoskeletal forces. There's a lot of wear and tear in the farm workplace. And every time I see young guys jumping off of tractors up at Colorado State University at the demonstration farm where we have often gone to do some AgrAbility training, I always tell those young guys, don't jump off the tractor. You're going to pay for that when you're 45 or 50, and they just kind of laugh. But I know that sooner or later, that's just, what happens. We wear things down. Other contributing factors, removing things like safety shields or other protective equipment. I was out on a farm visit just this past Friday, and the first thing that I saw was that the safety shield had been removed across the power takeoff. And, we all know from working with AgrAbility customers that this is often a common practice. Sometimes there's malfunction of equipment, either because of poor maintenance or lack of maintenance, but also just because of the engineering of the machinery or equipment had some type of flaw. So also puts the hand at risk. And many times lack of training or skill with using a complex tool or just using the wrong tool for the job. And this is where I like to say, and I'll probably say it more than once during this presentation, is that the hand is not a hammer. Now, I have violated that law myself and tried to bang on things to make them go together or work. But usually I just wind up needing some Advil later, and I didn't get the result that I wanted to with my hand. All right. Then we briefly talked about bites, but this shows a picture of an actual bite from an animal on somebody's finger. And it looks like really kind of a minor injury, but can you see the swelling and the redness that's involved? This finger is not going to bend. I'm going to just kind of draw a circle around all that edema, swelling that's in the finger. But in the farm workplace, you may be bit by a farm animal. You might be a vector for insect bites. different kinds of wounds, puncture wounds, which can be especially problematic because they usually leave some of the foreign material deep down in the wound and can become infected. And then you have crushing and tearing kinds of wounds that can also be the result of being stepped on or crushed while doing a task or activity. And then, of course, because you're in the farm workplace, these kinds of wounds, from minor to more significant, there's always that risk of infection or even some type of disease. I'm going to take a little sip of my Diet Coke there. Now, on this next slide, we're thinking in terms of chemicals and keeping in mind that plants have chemicals within them that can cause dermatitis types of wounds. There are vaccines, chemicals like fertilizers, herbicides, pesticides, and all of these can cause injury to the skin. On the top photo, I'm showing you a picture of contact dermatitis, and that is actually from poison ivy, which is in many workplaces on the farm or ranch, especially in wooded areas. And so you can see the lesions have the little blisters and the redness, and we know we don't want to pop those blisters because it's just going to spread that oil and spread the dermatitis. And then the wound on the bottom is another kind of contact dermatitis lesion, and it looks like it has happened underneath somebody's ring finger because it's just where the band was. So some foreign material or chemical or plant, whatever, managed to get underneath that person's ring and cause that kind of lesion. No lecture on farm injuries would be complete without talking about injuries to the upper extremity that happen because of falls, whether from a ladder or stairs or encountering different objects, heavy objects and so forth, or moving objects in the workplace, and of course slip hazards. And one of the common types of fractures is actually of the wrist, and often called a Colles fracture, and also an injury to the wrist of the scaphoid bone, which is right underneath the base of the thumb. And that fracture is often not able to heal because it has a very poorly designed blood supply. So often that scaphoid may have to be removed or fused, and then you have impairment of your ability to use your thumb. And then just, of course, other fractures of finger bones and so forth. The radiograph that I'm showing you is actually a fracture that looks like it has happened at the elbow, and it's a complete transverse fracture. I'll just draw a circle around that in yellow. Other kind of mechanisms of injuries happen because of our encounters with machinery. And in the farm workplace, you're going to see things like augers, belts, chains, use of saws, hitching, hydraulic leaks from hoses, and burns from mufflers and engines. And the kind of wounds that you can see from having a bad encounter with machinery range from amputations to fractures to avulsions, which are actually tearing and ripping of tissue, crushing, cuts, bruises, and burns. And the two pictures that I'm showing you actually are from a hydraulic leak. And this is a fairly innocuous looking injury. I'm going to draw a yellow circle around the lesion in this person's hand, and it's between the index and middle finger, and it just looks like maybe just a little injection or just a little itty-bitty tiny pinhole of an injury. But as you can see in picture number 2, that hydraulic fluid was injected at very high pressure, and it is going to continue to navigate through the hand and arm and tissue until it hits an equal and opposite amount of force. So it usually will stop against a bone. And this second illustration just shows that the hand has had to be decompressed so that all that foreign material can be removed from the fingers. And it really does create a fairly extensive wound and a very dirty wound, and is very prone to develop gangrene. My colleague Trish, who's not with us right now, but who contributed to putting this presentation together, is actually a certified hand therapist, and she tells me that even as an urban-based hand therapist, that many of the injuries that are referred to her in her clinic through the university hospital are from farm injuries. And these are some of the kinds of injuries that she sees. This next slide, and I'm not going to show you anything more gross than this, but this is just during a surgery where we're actually observing 2 pieces of tendon that have been completely lacerated being drawn back together with sutures, and the surgeon's using needle, thread, and a pair of forceps there. But the point of the slide is these are very elastic structures, and they are surrounded by very fine, closely knit tissues, and we depend upon those tendons to be able to glide and move freely. And this person will probably have some type of movement restriction because of just the amount of scar tissue that develops and the lack of frictionless movement of that tendon because of whatever injury occurred, some type of sharp instrument that severed that tendon in the hand. And then just showing you a slide that shows, we're going to look through a few things here, but the top slide, the top picture is of carpal tunnel. And we have the median nerve, which serves the hand and ring finger, a little bit of the middle finger. And it's in a very shallow space, so it's very easy to get that compromised by repetitive movement and swelling and just inflammation of that whole space, and it's very, very painful type of condition. And it's not as prevalent in most, I'd say, crop production and hay production and animal production, but where you might see a cluster of carpal tunnel problems is in the dairy industry, in the parlor, where perhaps you have a lot of repetitive movement at the wrist and fingers. So this slide we're talking about cumulative trauma and repetitive use types of injuries. So some of the other things that we'll see, strains and sprains, tendonitis, where the actual tendon becomes inflamed, the carpal tunnel problems that I just talked about, bursitis, which is another kind of inflammation in the joint, different kinds of cysts, vascular compromise, and of course just the mechanisms of arthritis. Let me see if I can advance those pictures. Okay, and here we're actually seeing Trish is here. She's coming in. So I'm going to move into dual mode. She's going to pull up a chair. And so right now, what I have on this slide are just showing different kinds of joint problems because of joint erosion. You have different kinds of arthritic nodes and finger deformities. So this first top deformity is actually, I probably should use a different color, but this is a boutonniere's deformity. And what has happened here is, well, the way I like to describe the finger is it's like it's beautifully in harness. It has different kind of pulleys and reins that allow us to straighten and bend the finger. And what has happened here is we've had a problem with the little pulleys that hold the reins, and the reins have actually come underneath the joint. So when the finger pulls, it can only just pull into that deformed position. All right. And then just talking about problems with vibration and cold and heat can cause problems with our hands in terms of vascular compromise, nerve damage, thermal injuries, and something called Raynauds syndrome, which I think I'll let Trish describe because she deals with this pretty frequently. So I'm going to hand her the headset. So welcome, Trish, to the AgrAbility world.
Hello. So Raynauds is pretty actually fairly common. It's more common a little bit more as we get older. There is no genetic predisposition, but it does have association with rheumatoid arthritis and other arthritic types of problems. And it can also be a problem just due to the vascularity in the hand. So if you have somebody who has diabetes or something like that, they may have an increased potential towards to have Raynauds. It's actually fairly easily combated with gloves, and if you're really in, extreme elements, I advise people to wear gloves with mittens over them, or get really, high dollar ski gloves to wear. You know what? And I don't think I should discount the role of vibration. We do know for sure that people who use vibratory types of tools, the longer they use them, the more the incidence of Raynauds goes up.
Thank you, Trish. Some of the other related injuries that are going to affect hand function are things like brachial plexus injuries, and that's an injury that can actually happen from a very dynamic and dramatic pull on the arm, but it's the brachial plexus is kind of between the neck where the nerves exit and between the shoulder. And anything that's happening above the hand is going to cause problems of the hand. And Trish noted that the nerves that are involved in brachial plexus injury happen between the cervical nerve 5 and cervical nerve 8. And then we have nerve injuries that can happen in the cubital tunnel, and that's just the little funny bone. So I'm going to draw this right underneath that bone is where the ulnar nerve is kind of shooting through there. And sometimes we hit our elbow and we get that really painful, it's not really funny, but we get that painful little sproing of electricity. And then we have trauma to the rotator cuff that can make it very difficult to position the arm for functioning in the farm workplace. And then mechanisms, I mentioned before, the pulling or pushing, dramatic, maybe you're hanging on to the halter of an animal and the animal violently turns its head, and you get kind of jerked out of socket. Overuse injuries. I don't know very many men who work on farms or ranches that don't have shoulder problems by the time they're in their mid-40s. Dislocations of shoulders and fingers, and then just, again, mechanisms of cutting or crushing. And these happen very frequently in the farm workplace. Okay, so now we're going to talk about just preventing hand injuries. And the first thing that we really need to think of is designing to fit a person's body size. There's really no such thing as average. And so it really, I think, is beneficial to provide adjustability in the workstation. In the occupational therapy department, we have several of the faculty that are now way into doing standing desks where they can swiftly move their computer monitor to standing or sitting position so that they're changing their body position. In the farm workshop, you're thinking perhaps more in terms of having different levels of where work can happen, lower surfaces, mid surfaces, higher surfaces. They all have their place in being able to manipulate materials. And usually we can design to fit body posture. So think in terms of there are three basic work positions according to NIOSH, and they're lying, sitting, and standing. But we know that there's all kinds of positions that happen between those postures and are often very asymmetrical postures and can actually be so awkward that they predispose us to different injuries. And then, of course, the need to stoop or squat or kneel in the workplace to orient our hand to whatever the work task is demanding. But we need to think in terms of, as AgrAbility professionals, of looking at workspace and thinking in terms of, can we design this to fit this individual better? Okay. There we go. My clicker was not working. So designing for hand use, think about the fact that tasks fall into 5 major groups. There's the real fine manipulation that we do, like assembling small parts, nuts, bolts. Writing is considered a fine manipulation. Then there are the hand tasks that require fast movement to an object, like hitting a kill switch. Then there are frequent movements between targets, like when we're doing some type of assembly task in some kind of order. And then hand tasks can also be forceful activities with little displacement. So like turning a wrench or a screwdriver, you're exerting a lot of power through the forearm and grip of the hand, but you're not making a long movement. And then, of course, there are forceful activities with large displacements like hammering. So those are ways that you can also look at the tasks that your farmer or rancher is doing. We work a lot with hand tools. Hand tools are great. They make it easier to do a job. The purpose of the tool handle is to maintain secure control. But the tool handle should fit the hand, the contours of the hand. This is a problem where women in the farm and ranch workplace often have problems because tools are made for an average size and are usually, the grips are too large. And really the right tool grip, and Therese Wilcombe used to talk about this a lot in her presentations, but a tool handle should fit in your OK sign. And I don't know, I look at that OK sign that I have, and that's not a very big tool handle. And then, is a tool made for a right or left hand? Does the tool require precision grip or a power grip, and then consider the transmission of energy between that tool handle and the hand. When I'm hammering on something and the energy is translated through that wood handle, I am really feeling that upstream from where I'm hammering. And so some tool handles, you can choose from fiberglass or metal or wood, and they all have their benefits and they all have their limitations. And then just, of course, the whole issue with is it better to use manual tools or power tools? And, we know that it just depends. Some people are susceptible to vibratory injury, and that occurs with power tools. So another thing that we need to observe during our AgrAbility assessment. Just in working with tools, some general principles to remind the folks that we work with and ourselves is just to keep our tools in good condition and give them regular maintenance. And again, use the right tool for the job. The hand is not a hammer. Examine each tool for damage before use. And this was new to me. Don't use damaged tool. Tag it as do not use. And I can't count the number of barns and workshops that I've been in where there are tools upon tools upon tools that you can see that they're in disrepair. So just get them out of the workplace so that they are not accidentally used. Another general principle, just use the right personal protective equipment and use it with the right fit. Something that I need to do more of is just securing work on my table with different sizes of clamps or vises. And of course, don't pull on cords, don't carry tools by their cords, and then direct the tool away from other people so that they are not in danger of things flying out from the tool area and striking them. And unless the tool is approved for work in a damp area, don't use an electrical tool in a damp or wet area. And those principles came courtesy of OSHA. And on this slide, I'm just showing two different kinds of approaches to the workplace. The top photograph is, the top illustration is a picture of a gentleman in a workplace where the tools are scattered everywhere. There's oil on the floor. There is an accumulation of shavings from this lathe that the person is working on. And then there's the other individual in his workshop where every tool has its place. The workplace is clear and clean, and there's nothing to trip over. And so it's just to illustrate the point that the most effective control is to engineer out risk of injury, and that's what we depend so importantly on our agricultural engineer workforce to do. But when the risk can't be designed out, then doing things that increase safety is absolutely essential. So remembering to use shields and personal protective equipment. It looks like we have about 10 minutes, so I better hurry up. Prevention of hand injuries. Make sure folks are familiar with PPE, that they're using correct gloves and safety equipment. Make sure you're taking off rings, watches, jewelry. Don't wear gloves near machine gears or other devices that can grab onto that and pull you into the machinery. Keep guards in place. Keep sharp blades and needles pointed away from the body. Cut away from the body. And use push sticks with table saws. Fitting gloves, many different kinds of materials. and they all have their use in the workplace. And one of the things to think of is cotton gloves are really nice for just general work. Leather gloves are really good for heavier duty general construction. They do make anti-vibration gloves, and I think the research is still kind of out on whether they're beneficial or not. Some tasks that you're doing might require Kevlar or wire gloves, especially when you're working with materials with sharp edges like sheet metal. The whole realm of rubber, nitrile, neoprene gloves is a day-long class, and the main thing is use the right glove for the right chemical. Okay. Preventative things that our customers can do and that we can do for ourselves: take breaks, switch tasks, break tasks into shorter sessions, store our tools, avoid sustained constant gripping, and plan ahead and arrange the workspace so that everything's just right where you need it. And that came from the American Society of Hand Therapists. That's their suggestions. In terms of skin care, limit exposure to things that are irritants. Use protective creams. Wash your hands immediately after using chemicals. Wear a cotton liner under your rubber or synthetic gloves to limit the effect of sweating. And those fleece-lined, or not fleece-lined, but those flock-lined gloves, don't even bother with those. They actually are worse, I think, than not wearing a cotton liner at all. And even down to the detail of washing your hands, it's recommended that we don't wash our hands with solvents, harsh soaps, or abrasives, although I know we do, because sometimes that's just seems to be the best way to get oil and grit and adhesives and things off of our hands. But there are other cleansers that will do the job, and the Society for Dermatology recommended soap-free substances like Cetaphil or Neutrogena. I don't know if you have an opinion about that, Trish.
I don't in particular for this.
Okay, she doesn't in particular for this, but make sure that you have cleanser in numerous locations where it's needed, and then apply an after-work conditioning cream to increase the moisture in your skin so that you don't get those painful little cracks and crevices that happen, especially in winter. And I think this is important as well. Just after work, look for any cuts, rashes, abrasions. Get medical attention if it's necessary. Clean and bandage all your cuts and abrasions. Get the splinters and grit and stuff out of the wound. And in winter, avoid contact with moisture. Minimize sweating of your hands. And Trish mentioned this a minute ago. Buy the good ski gloves or whatever, but buy the best insulation glove, and that's Thinsulate. And I know that's kind of a product recommendation, but it's in numerous brands of gloves, and get it with multiple layers and with extra sewn seams and so forth, so that you are protecting your hands against the weather. Would you mind going through the basic exercises? I've got some warm-ups, therapy, and so forth. Okay, so I'm going to hand it over to Trish.
So I'm looking at this with general exercises, but I just kind of want to go back and just touch on something really quickly, cubital tunnel, because I think that that's probably something that you would find a lot in ranchers and farmers and this type of population. And, I think one of the things that we kind of don't think about so much is that we call, in the hand world, we call cubital tunnel the other carpal tunnel, because it's become so frequent. And it's really something that's fairly easily preventable or at least you can decrease some of the risk. Now, I can imagine someone who goes out and picks up bales of hay all day long is going to have an increased risk for this. So one of the things that I would say is doing some general warm-up exercises like this, folding your hands together, doing some nerve gliding types of exercises can really help that out. The other thing is that there are products made that will go on your elbow that are soft splints that decrease the amount of full extension or full flexion that you would have at the elbow, and we know that this, along with padding the cubital tunnel, will help. Tendon gliding exercises like the slides that are up, and even taking those tendon glides and a step further and taking them to the shoulder and maybe putting the shoulder out and getting the hand all the way back will open up some of those, this particular stretch will open up the carpal tunnel. So, just looking at some simple things, the thing I'm talking about, or the splints I'm talking about for the elbow, is something called a Heelbo, Heelbo. It's readily available in hospitals or like a Walmart or a Walgreens, and it's a real inexpensive fix for a problem that can be something of a big problem later. Strengthening. I am not a real big therapy fan in terms of strengthening. I think that it's good for post-injury if we're trying to strengthen somebody post-injury, but I think that the majority of adults that come in that have really physically active jobs, they come in with a really strong grip strength to begin with. So, I think this might be something you might see a little bit more post-injury myself.
No, that's fine.
Arthritis conditions, we are looking at the majority of a big majority of our population having some form of arthritic condition. It's actually, we're looking at a number of about 1 out of every 5. So when we're talking about arthritis, especially in terms of working outside and in areas where we might have to have a lot of force on our joints, you need to modify the activity, take frequent breaks. Know that if you have pain following an activity that's lasting greater than an hour, we may need to look at that activity and break it into smaller components, or have an occupational therapist look at the activity and perhaps redesign it. We have splints that are readily available now for people who have like a thumb arthritis or something that will give some assistance while they're doing some specific tasks. And then, of course, always use adaptive devices when they're available. So I'm here for questions. Ask me. Will I hear something, Carla?
Well, thank you very much, Carla and Trish, for that excellent presentation. Just a wealth of knowledge, and I'm sure that will be valuable for those in the future that would like to see the archive versions of this. I think it's just got some great overall information. So we're into the poll time and the questions and answer time. I will be doing 4 quick poll questions. Sean Ehlers will be providing preparing the question and answer time. So we'll be doing that. If you can hang on for just a few minutes, we will be finishing up here in just a second. I have one message to pass on to Sean so we can get that onto the question and answer time. Okay, our poll questions, our 4 quick poll questions. Our first one simply asks your affiliation. So if you could let us know which category best fits your particular situation. We appreciate your input on that. We'll give you just a few more seconds on that one, so if you could go ahead and make sure you click the radio button and the submit button, both, when you're submitting your poll questions. Also, just a note, if you have more than one person viewing at your computer, say you're in an office and there are multiple people viewing, if you could let us know that also through the chat window, that's helpful for us in terms of recording and participation. Now it's closing the poll, but it's allowing some people to finish, I believe, so just a couple more seconds here. So hopefully you'll be able to see the results. Okay, our second poll question asks about the information that was presented today. And it asks if the information was valuable and met your expectations. Okay. Appreciate your input on that. We'll be closing the poll here in just a second. And hopefully you're able to see the results. Okay, our third poll question asks about the technology that was used today. And was the technology usable for you today? Any problems? And if you did have specific problems, we ask that you would please let us know in the chat window so we can try our best to remedy those in the future. We will be sticking around to answer all our questions. We appreciate those that have submitted them in the chat window. Again, if you have ones you'd like to ask verbally, please raise your hand using the raise hand icon. Okay, and finishing up our poll here. Looks like some people are still in progress, so it's going to allow you a few more seconds to do that. I do have several questions, so please stick around and get some more great information. Okay. And do you have one final question? Asks, based on today's session, would you attend another session in this series? And so, the poll is now open. If you could respond to that, please. A few more seconds on that, and we will close that and begin our question and answer period. And since we're running short on time, just a reminder, this afternoon we're going to be talking about veterans involved in agriculture. We'll have have staff from the Texas AgrAbility project to talk about some of the resources that they've been developing down there, and also other resources that are available to anyone in any state. Closing the poll now and displaying the results. Okay. As soon as I save the results there, we will be moving on to the question and answer period. I am going to be muting my microphone again and passing the presenter ball to Sean Ehlers, who will be putting the questions up for our presenters, and we'll go from there.
So the question is, what is the current state of hand transplants, and are they generally successful? So I don't think that there are a lot of hand transplants being done currently. They're done in big centers, and if you have somebody who's young, it's a much more likely occurrence. They are high risk. Whenever you are transplanting a hand, you're transplanting vessels, nerves, tendons. You have a plethora of things that can go wrong. And I think, if you have somebody who's young and you can get the hand to revascularize, then you can always have that hand as a helper. So are they generally successful in that you have a hand that you can help with? Yes. Are they going to have finger range of motion and strength like a hand that's not transplanted? Not likely. And I think the other thing that, sometimes we don't think about is that when we transplant a hand, the person that's the recipient of the hand transplant has to be on medicine for the rest of their life. They have to be on an anti-rejection protocol. And, it can cause some fairly, major health concerns. So, I don't have numbers. I mean, I wasn't really kind of expecting this kind of a question. So I hope I'm answering it as fully as the person asking wants it to be answered. What are the symptoms of Raynauds? Well, Raynauds has a high variability. Symptoms of Raynauds can be anywhere from, numbness and pain, typically at the tips of your fingers. There can be a change in color. People with very aggressive Raynauds will have very, very white digits. But the symptoms of Raynauds when people are exposed to cooler or cold temperatures will increase, and they can become very, very painful in terms of burning. Because of hand and shoulder issues, do you recommend power wheelchairs over manual wheelchairs? Yes. I think that for me, if I had to be in a wheelchair, I'd rather use my hand and my shoulders to do other activities than to spend all day powering my wheelchairs. Question 4. There may be some instances on the farm where meat cutters' gloves might prove useful. They protect your hands from sharp objects.
Yeah, like Kevlar.
Well,
Absolutely.
yes. Is there a maximum duration you would recommend for someone using tools with considerable amount of vibration? I believe, I'm not sure that there's any standard out there. I would definitely say under an hour. I would also say for the person to really make sure that they're paying attention to their symptoms. We know that people who use, like for instance, jackhammers have a high increased risk of carpal tunnel syndrome. So if I was using a tool that had a vibratory component, if I started feeling any type of numbness or pain in my hands, I'd definitely use it or stop using it, take a few minutes before I started using it again. Do you have a handout or booklet on hand health on the farm?
No, but we should probably do one.
There. So not currently. Question 7. I had CMC joint arthroplasty surgery 2 years ago and my hand is still stiff. Is there any hope that I will regain full movement? I have worked with an OT who specializes in hands and have several splints for farm work. So for everybody else who's listening, CMC joint arthroplasty is when we surgically remove arthritis from the carpal joint of your thumb and reconstruct it, typically using some form of tendon, the CMC joint is one of the most common joints to get arthritis in the hand, unfortunately, and it's the joint that we use a lot when we're, any type of thumb surgery or any type of thumb use that we have. There are a plethora of different arthroplasty procedures being used today, probably a good 15, and unfortunately, they all come with different kinds of splints and different kinds of rehab protocol. 2 years following an or a CMC arthroplasty is a little long to still be stiff. I would definitely continue to try and regain full movement. And if you're talking about joint stiffness in your fingers, I would really advise doing intrinsic stretching, where you push your fingers somewhat into a claw position. And this is also one of the places that I would recommend using some therapy and maybe some heat. So yes, 2 years out you can still regain movement, but I think you should probably be very aggressively working on it. Question 8. Hands and fingers that have been injured seem to be more sensitive to cold temperatures months and years after the injury. What steps might one take to protect injured hands from cold? So, I just want to put a little personal experience in this, because I am a hand clinician that's seen patients for greater than 25 years. One of the injuries that we see very frequently from farming and ranching is crush injuries, or injuries related to saw or roping injuries. The number one way to lose your thumb is from a rope. And whenever we have really, really bad traumas happen to the hands, when we have crush injuries specifically, the injury comes with an injured vessel. And so, when we think about having a big artery injured in the leg, people have it's a no-brainer that you're going to have some problems with the leg. But people tend to forget we have so many vessels in our hands. So the tips, what I might do to protect my injured hands from the cold, once again, are, really good gloves, gloves under mittens, Kevlar gloves, buying the little hand warmer gels that you can get from sporting goods stores. I know I'm a competitive cyclist, so I bike a lot in the cold. I have really, really good gloves, and then I have the little hand warmers that I can stick in my gloves at the same time. I hope that answers the question. Question 9. Can you mention some specific AT for individuals who have limited grip? Okay, so if you have limited grip, this is where Dr. Wilhite's suggestion of therapy. There are different grades of therapy. I also recommend that people get active. We know that aerobic exercise increases people's grip. I, in clinic, will also often give my clients, patients, rolling activities with weights, where they're not just continuously squeezing, but maybe doing some more rolling types of things. Do you have something to add?
I'm kind of the AT queen, so some of the things that we can do to try and increase grip with just the strength that a person has is just increasing friction on the tool handle. So maybe I'll dip it in some plastic grip just so that when I wrap my hand around that tool handle, it's helping me hang on to it just a little bit tighter because of friction. And again, making sure that the tool handle is the right size. So if the tool handle is too small for the person with limited grip, they're going to have trouble hanging on to it. And if it's too big, they're going to have trouble hanging on to it. So either building the grip up so that it's big enough, or getting a tool with a smaller handle can help. And then I know of one glove that kind of fits like a mitten, and it has the Velcro straps that help secure a tool handle within the hand. The only problem that I've seen with that is that perhaps you can't get it tight enough that you might be able to do some hammering, but you could still perhaps use that glove as to help the hand be an assist.
Okay, thank you very much. We do have one other question, and I will add that I think the AT you just mentioned may be in our Toolbox Assistive Technology database. We've got the Active Hands Gripping Aid, and it's a Velcro strap that you can attach to some tools. So you might want to check out the Toolbox. The other question we had from our chat window: what gloves or aids would be best for hot walkers and horse grooms?
Wow, that's a good question. What gloves would be useful for people that are doing hot walking? That's a great question, and I'm willing to delve in and find out about that. I think my gut reaction is a well-conformed glove, so that if the head of the animal jerks, that my skin is protected. And that it won't get caught up somehow in the buckle or the rope or anything like that. But I will look into that and post the answer perhaps to the listserv.
Okay, thank you very much again. An excellent presentation and some great questions. So again, we will be archiving this, putting on our website, and Trish and Carla, thanks again. That's just some great stuff there. So please feel free to join us this afternoon. Same URL for our discussion on veterans and agriculture. And so thank you very much.
Thanks, everybody.